Have you ever gotten out of bed in the morning with stiffness and pain in your joints? Maybe it's hard to grab onto something, or it hurts when you start to walk. Sometimes this pain is temporary or the result of a strain. Other times it could be a sign of something more serious, like rheumatoid arthritis. Doctors with the OhioHealth Network say a proper diagnosis is the key to easing or eliminating your pain. From her office at Grant Hospital, Dr. Heather Lake spends her day diagnosing and treating patients with rheumatoid arthritis.
Because we usually break arthritis down into two major categories. There's degenerative or osteoarthritis, and then there's inflammatory types of arthritis.
Rheumatoid arthritis is a chronic, long-term disease that affects the joints. It causes joint pain, stiffness, and fatigue. Over time, the joints can become permanently damaged, leading to long-term disability. So the key to managing RA is to diagnose it early, then treat it aggressively.
For everybody, it's a little bit different because all patients are kind of on a spectrum, and some patients may have very mild disease that may start very gradually, and over time, just include a couple of joints, and they don't need much more than an anti-inflammatory. For other patients, it can start in one joint and very rapidly spread throughout most of the joints, and they need to go very quickly onto some of the stronger medications that we now have available to us.
RA's effect on the body is usually symmetrical, so if it hits one hand, it will likely hit the other. It can also affect anyone, especially those who have a genetic predisposition to the disease, though it is more common in women. So how do you know you have RA?
Usually patients who have an inflammatory arthritis will notice swelling to their joints, redness, warmth, and then again it may be worse at certain times of the day, like when they first get up they're very stiff and immobile, and then as the day progresses they start to notice some improvement, and it can get to the point where the pain is so severe that they know something is going on.
To say Dr. Lake knows the disease like the back of her hand is not paraphrasing a cliche. It's a reality. She was diagnosed with RA about 13 years ago.
For me, it was very aggressive from the beginning. I woke up one morning and my hands were closed shut and they were very difficult to get open. And being in college at the time, I thought maybe I was just, writing too much or, studying too much. And so after a couple of days of it happening over and over, waking up with my hands being closed shut and improving throughout the day, I knew there was something going on. By the time I saw the rheumatologist, it was not just my hands, but it had progressed to my feet and elbow, knees, and other joints. So it was coming, pretty rapidly.
Dr. Lake suffered permanent damage in her right hand. When she was first diagnosed, it was common to treat RA first with the most mild drug therapy, then gradually ease into stronger medications.
Now we know that you want to get started on, something strong right away and then decrease, because any damage that's done from rheumatoid arthritis or an inflammatory arthritis is irreversible. So you want to really get things under control from the beginning.
The OhioHealth network of hospitals and clinics offer not only comprehensive treatment of rheumatoid arthritis, but ease of access.
The nice thing about, our office in general is that we have an infusion suite right here at the office. So if we have a patient that we want to put on one of the medications that requires the IV treatment, instead of sending them to the hospital or to another facility, we actually have the suite right here in the office. We have, facilities in other areas. So if there's a patient that lives on the west side or the east side, we each split up a day a week and go to these sourcing locations, so we can kind of meet the needs of our patients a little bit better.
Dr. Lake's office is just one in the OhioHealth network that treats all forms of arthritis and autoimmune diseases, and the convenience of the infusion rooms is a tremendous help for patients like Shonda Jordan, who suffers from ankylosing spondylitis.
I was a nurse, and I thought I had low back pain like a lot of other people out there, and it wasn't low back pain. It was joints fusing, a lot of inflammation and just swelling, and it continually got worse.
AS is a long-term disease that inflames the spinal joints and the joints between the spine and pelvis. It eventually causes the spinal bones to fuse together. Though Shonda cannot stand fully straight, the anti-inflammatory treatments have helped give much of her life back.
It has given me back some of the movement that I had lost in my hips, my shoulders, and my neck. I have a 9-year-old daughter, so I get to go outside and do a little more things with her. I was able to go swimming with her this summer, which was something new for both of us. And just my life back. It really does. It goes from laying around and hurting all the time to up and going to the grocery store, a normal everyday activity for most people that you miss doing.
You can contact the Grant Arthritis and Osteoporosis Center by calling 614-566-9380. And you can also log on to the website at grantarthritis.com. These links are also posted on the Daytime webpage. The preceding portion of Daytime was sponsored by the G. William Parker, M.D. Fund for Health Education through the Grady Memorial Hospital Foundation.